This morning, what we're going to get a chance to do is have a conversation about healthcare and healthcare reform and initiatives that are taking place.
We are on a 10-hospital, 10-county tour to talk about healthcare. And last year, during the first 9 months, we went all around the state, really focusing on just making sure that we understood so many of the issues regarding the uninsured. And we have 95, literally 95 meetings around the state and various counties talking with many people about the fact that we have so many people, 800,000 people in our state that are uninsured. This week, what we're doing is actually moving around the state talking to providers. People like you that actually provide.
I think all the physicians here would agree that we feel the crisis is already here, and it's just nobody's screaming about it yet because the people who aren't being served are not the people who necessarily know how to get the message to the legislators.
The medical person yourself, finally, did you share the same frustrations that some of the doctors and nurses were talking about in there, saying, I just don't know what's going on right now, I just want to maybe get on one single plan?
Well, I think that anyone who is in healthcare gets frustrated with the complexity of the system, and because of the complexity of the system, it drives costs up. What most people who are involved in healthcare are interested in is taking care of patients. They want the most seamless way that they can take care of the patients that come into their office, and that's what I think those of us that are in healthcare are interested in. I think those of us that are in elected office are interested in is trying to get the best care to the individual citizen and creating a system that provides that more economically than the current system does.
This much time talking about an issue that we all care so much about. I appreciate you coming out here, everyone. Thank you. What we're trying to bring is a financing mechanism that allows every Tennessean to have access to quality, affordable health care. And as you mentioned, it is complex. There are lots of issues. We have a bill that actually does that. And today we're here talking with providers to make sure we understand all the nuances. I think you saw a number of very intelligent questions today about the bill and about how we're going to go about doing that. And what we'll do is take back the input that we're receiving here tomorrow at Bonner and Memphis and later today in Marion County. We'll take that input and continue to tweak this legislation. But bottom line, we're focused on legislation that would cause every Tennessean and every American to have access to quality, affordable, private health care. And I think the moment's upon us where we can actually do that in this next year.